Hi, this is Sarah Rudolph with Vital Life Physical Therapy in Longview, Texas. I'm going to do a series of basic exercises that would be great if you are a person who suffers from back pain, and particularly if you have just had back surgery, or if you're going to have back surgery. These will be great for you to do right after surgery to help get the muscles along your spine and your deep core muscles reactivated and ready to do their job in supporting your spine. So the first thing you're going to do, you'll be lying on your back, and you want to work on activating your deep abdominal muscles called your transversus abdominis. So what you'll want to do is just take a nice deep breath, allowing your belly to rise up. And then on your inhale, you'll want to pull your lower belly, below your belly button, in towards your spine. And then you're going to hold that contraction there while you take another 4 or 5 breaths. And then you're going to release that. So I would advocate that you practice about 5 or so in a row of those. So you're going to inhale, allow the belly to rise up, and then on your exhale, pull the lower belly towards your spine and hold it there while you take some normal breaths. This helps to activate the deep core muscle called the transversus abdominis, which helps in stabilizing your back. Then while you are holding on to that deep core muscle, the transversus, you'll want to start doing some heel slides. So you're gently and slowly going to slide one leg away from you and then bring it back up towards you. And then alternate, slide the opposite leg away from you and bring it back towards you. And you'll want to repeat that about 5 to 10 times with each leg. This just helps to get the nerves and the muscles in the leg moving and just get some gentle mobilization up into your lower back. And then to stimulate the muscles on either side of your spine, you'll want to straighten out your legs. And then you're going to push the opposite arm and leg down into the bed and hold for about 5 to 6 seconds. Then you're going to release those two, and then you're going to push the opposite arm and leg down. Hold again for 5 to 6 seconds, and then release. And then continue to repeat that with the opposite arm and leg, pressing down into the mat, holding for 6 seconds, and do that about 5 to 10 times for each pair of limbs. And you should be able to feel the muscles next to your spine contracting with this. So no movement is taking place, and you can gauge how strongly you would like to do the contraction according to your pain levels that you are experiencing soon after surgery. These are really simple exercises, and you should be able to do these 2 to 3 times a day, and that will really help to start getting the muscles next to the spine and your deep abdominal muscles ready to do their work of supporting your spine as you get ready to start to move around a little more. A couple of the other exercises I usually encourage people to do is just your basic single knee to chest stretch. You can do it with the other leg bent up or down straight. You'll want to relax your head on your bed and relax your shoulders. This is just encouraging a nice gentle stretch up the back of the hip into the lower back. And I would encourage you to hold this for at least about 90 seconds to get a nice, gentle, prolonged stretch on those structures that have been traumatized through the surgery. And then you'll slowly lower that leg down and repeat the same stretch with your opposite leg. Also holding for 90 seconds. Then you'll want to bend both legs up. You'll want to do some very small tilting movements with your pelvis, and that's going to gently flatten out your back and then allow the back to come up off of the mattress. Gently flatten it in and then allow it to come up off the mattress. And then the last one that you'll want to be doing is just some gentle rocking side to side. You're only going to go as far as your pain allows you to go, but as you do more repetitions and as the days go by, you'll be able to go further and further over towards the mattress until you're able to reach the mattress. And wherever your stopping point is, even if it's only halfway, After you've done about 10 repetitions, you'll want to let your legs hang there for as long as you can tolerate. If it's only 10 seconds at first, that's fine. You'll want to do some deep breaths, but hopefully as time goes by, you'll be able to hold this for longer and longer to where you can tolerate the stretch position for at least about 90 seconds, and that'll give a really nice release and stretch down on the muscles on the side of the body opposite to where your legs are. And then you'll want to repeat that stretch over to the other side. So with all of these exercises, it's great if you can just keep a little bit of tone in that deep abdominal muscle, the transversus, that I started out teaching you how to contract. And that'll just give you a little bit of added stability with those movements that you're getting ready to do, which will then help you to move around more freely as you start getting out of bed and walking around your room and around your home. I hope you found these helpful. Feel free to reach out to me for more information. www.vitallife-pt.com